The Medical Publishing Insights and Practices Initiative, or MPIP, was founded in 2008 by members of the pharmaceutical industry and the International Society for Medical Publication Professionals. The goal of MPIP is to promote a more effective partnership between industry sponsors and journal editors in order to raise standards in medical publishing and expand access to research results. To further our aim, MPI convened a roundtable meeting in 2010 with journal editors and pharma representatives in order to brainstorm ways to close the credibility gap in industry-sponsored research. While participants acknowledged that there have been improvements in the conduct and reporting of industry-sponsored studies, they identified 10 opportunities for continued advancement. After the workshop, a subset of editors and the MPIP co-sponsors convened to collaboratively summarize the feedback from the meeting and the implications as they are captured in the Mayo Clinic Proceedings article.
This article is intended to serve as a roadmap, if you will, for how sponsors and journals can collaboratively improve standards for all medical research studies and publications. The article highlights critical areas that merit attention in terms of policy, education, and other activities. Also relevant to other stakeholders as well, including authors, medical writers, publishers, and members of the public. In short, anyone who is interested in how to improve the credibility of industry-sponsored research reports. One area was trial results. I think one of the biggest issues is how to make public all results in a timely fashion while avoiding redundancy. Many sponsors have committed to disclosing results through trial registries. It's equally important to disclose results that are negative, confirmatory, inconclusive, or less immediately relevant to physicians, provided there is not redundancy, duplication, or outright plagiarism. We also thought we needed to explore novel approaches to research results dissemination, for example, journals dedicated to these sorts of studies, novel article formats, review procedures less focused on impact. One area we touched upon in great detail was author education, how to educate authors on how to develop quality manuscripts. Many authors are not formally taught or well-versed in the best practices of manuscript development, resulting in ineffective reporting that can diminish the quality and credibility of manuscripts. We felt there was an opportunity for collaboration between sponsors and journals, including the dissemination of guidelines and resources and development of new collaborative seminars and other examples of ways of teaching. Editors should also expand their educational activities, especially within academia, regarding authorship best practices. Another area of authorship that we felt important was to continue to educate people about disclosures and continue education to end ghostwriting and guest authorship. Significant progress has been made in this area by incorporating guidelines from groups such as the ICMJE, AMWA, and COPE. But gaps still remain, and prohibited practices must be completely eliminated. Industry should continue to work toward complete disclosure, and in parallel, journals should ensure that they do not discriminate against industry authors.
The top 10 recommendations for closing the credibility gap in industry-sponsored research are really intended as a call to action. The goal is for all stakeholders to enhance transparency and quality in medical publishing. The recommendations are designed to be practical and actionable to stimulate positive change on the part of both industry and the journals.
And they highlight opportunities for collaboration across industry and with journals to drive positive change. For example, educational activities and policy refinement.
MPIP has taken authorship as a key focus for 2012 and will be working with industry sponsors, journal editors, and authors to raise awareness of best practice in this area and also to provide further clarity around authorship guidelines.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.